Eravacycline, detailed drug information. 1. Generic name, drug class, drug forms, brand name. Generic name, Eravacycline. Drug class, fluorocycline, a synthetic tetracycline-class antibiotic. Drug forms, powder for intravenous IV infusion, reconstituted solution, brand name Xerava. 2. Definition. Eravacycline is a novel, fully synthetic tetracycline-class antibacterial used primarily to treat complicated intra-abdominal infections. It is particularly valuable for treating infections caused by multidrug-resistant MDR bacteria, including some carbapenem-resistant organisms. It belongs to the fluorocycline subclass, which improves its activity and resistance profile. Mechanism of action. Eravacycline acts by binding to the 30S ribosomal subunit of susceptible bacteria, inhibiting bacterial protein synthesis, blocking the addition of aminoacyl tRNA to the mRNA ribosome complex, leading to inhibition of translation and bacterial cell death. Note, it is bacteriostatic in nature, but can be bactericidal against certain organisms depending on concentration and bacterial species. Now for indications. FDA-approved indication. Complicated intra-abdominal infections, CIAI, in adults caused by susceptible organisms such as Escherichia coli, Klebsiella pneumonia, Bacteroides fragilis, Enterococcus faecalis, Streptococcus aeruginosus group. Investigational off-label uses, hospital-acquired infections, multidrug-resistant, MDR, gram-negative bacterial infections, potential use in carbapenem-resistant Enterobacteriaceae. 5. Contraindications. Known hypersensitivity to eravacycline or other tetracycline-class antibiotics. Pregnancy, Category D, risk to the fetus due to inhibition of bone growth and teeth discoloration. Pediatric population under 8 years of age due to risk of permanent discoloration and enamel hypoplasia. 6. Before taking this medicine, precautions. Inform your doctor if you have liver disease, since the drug is metabolized hepatically, history of antibiotic-associated colitis or C. difficile infection, history of allergic reactions to tetracyclines, photosensitivity or skin disorders, are pregnant or planning pregnancy, are breastfeeding, it may pass into breast milk, avoid excessive sunlight or tanning beds due to risk of photosensitivity. 7. How to use. Eravacycline is given intravenously IV, by a healthcare professional. Reconstituted powder is diluted and infused over 60 minutes, administered every 12 hours. The treatment duration is typically 4 to 14 days, depending on the severity and response. Do not attempt to self-administer. Always follow the prescribed course to prevent antibiotic resistance. 8. Dosing information. Standard adult dose, 1 mg kilo IV every 12 hours, infused over 60 minutes. Duration 4 to 14 days, depending on infection severity. Dose adjustments. Renal impairment, no adjustment needed. Hepatic impairment, child poo class A or B, no adjustment. Child poo class C, severe use with caution. Data is limited. Missed dose, overdose. Missed dose, managed by the healthcare team. Missed doses should be given as soon as possible, but not doubled. Overdose, rare due to hospital administration. Symptoms may include nausea, vomiting, or liver enzyme elevation. Treat symptomatically with supportive care. No specific antidote available. Nat 10. Stop or avoid taking. Stop eravacycline immediately and inform your doctor if you develop signs of a severe allergic reaction, rash, swelling, trouble breathing. You experience persistent diarrhea, could indicate C. difficile infection. Liver function tests show significant abnormality. Avoid taking if you are pregnant or breastfeeding without your doctor's approval. You are taking potent enzyme inducers like rifampin or phenytoin, may reduce drug effectiveness. Side effects in detail. Common side effects: nausea, vomiting, diarrhea, infusion site reactions, pain, redness, elevated liver enzymes, ALT, AST. Less common but serious side effects: Clostridioides difficile-associated diarrhea, CD8, may cause life-threatening colitis, hypersensitivity reactions, rash, itching, anaphylaxis, liver injury, elevated transaminases, jaundice, rare, photosensitivity, increased risk of sunburn, superinfections. Prolonged use may lead to fungal or bacterial overgrowth. Report immediately. Persistent fever, rash, yellowing of skin or eyes, or difficulty breathing. 12. Vital information. Do not use to treat viral infections like the common cold or flu. Overuse or misuse can lead to antibiotic resistance. Monitor liver function during treatment, especially in patients with hepatic conditions. Do not skip doses, may lead to decreased effectiveness and bacterial resistance. Avoid sun exposure and use sunscreen protective clothing if outdoors. Use non-hormonal contraception during treatment due to reduced efficacy of birth control pills. 13. Other drugs that will affect Eravacycline. Drugs that decrease Eravacycline effectiveness. CYP3A inducers, increase metabolism of Eravacycline, rifampin, phenytoin, carbamazepine, phenobarbital, St. John's wort. Drugs affected by Eravacycline. Oral contraceptives may be less effective. Use backup contraception. Anticoagulants, e.g. warfarin, monitor INR closely. PGP substrates, e.g. digoxin, colchicine, possible interaction. Thank you. Have a nice day.